You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, bioidentical hormone replacement therapy and weight loss. My first guest is Dr. George Weiss. Dr. Weiss is the medical director and founder of Wellness and Longevity Center in La Jolla, California. Dr. Weiss, welcome to the program.
Great to be back again. Thank you.
Now, you just moved into a medical spa.
Yes.
It's yours, is that right?
Yes. It's called MedSpa 858. I'm very excited about it. It's a beautiful new facility that we just moved in. And the great thing about it is that not only do we have the typical medical treatments such as weight loss, nutrition, bioidentical hormones, supplementation, but now we can offer a full program where we not only take care of the inside, but we also take care of the outside. My motto is plastic surgery from inside out and outside in. Actually, one of the first ways we can diagnose any internal problems is how it looks on the outside. Sometimes certain skin problems or weight problems or loss of tissue is a manifestation of either improper nutrition.
I mean, some people definitely age quicker than others.
Well, of course.
Do you think you can have an impact on that?
Of course. Obviously, what we try to do, as you know, as we get older, our hormones start to decline and we start the aging process. And part of this is not only that we gain weight, and usually, unfortunately, as our hormones decline, we start to put fat around the middle. But the other thing that happens is we also lose some of our muscle mass. And the worst thing is that we lose fat tissue where we really don't want to, such as in the face. But all of these things can be reversed potentially with use of hormone replacement, bioidentical hormone replacement naturally. Also, proper nutrition, proper supplementation will affect your skin, the way you look, the way you feel. All of these things are sort of like integrated. So I'm very excited that we now have sort of like a one-stop shop.
Okay.
Where you not only have to, in order to look great, Randy, you really have to feel great.
Now, you're in great shape yourself.
Thank you.
You're walking the talk.
Yes, thank you.
I mean, you take your own advice.
I take my own advice, and I see you look wonderful.
That's right.
And you look a lot better than I last saw you.
Yeah, I was about 40. You know, if people just tuning in, this is Dr. Weiss, and I try not to ever endorse doctors that come on this program.
Thanks a lot.
Did go to you. I said, okay, I'm going to take some advice, and thanks to you, I'm down 40 pounds. It was very easy for me, you know, with your testing and things like that. But you picked it up a notch as well.
Yes, because, you know, I see so many of my colleagues when I go to these conferences, they talk the talk, but they don't walk the walk. I see this all the time with other physicians. And I want those doctors, they actually come to see me because a lot of them, even though they want to look good, they can't do it. And so they need a coaching. They need somebody.
You say you look at yourself as a coach.
Yes, because part of the whole process of learning how to live, how to eat, nutritionally and otherwise, you have to have. It's not so much a weight loss process, it's a way of life. So you have to learn what to do. So you have to eat properly, proper nutrition, proper supplementation. Activities are extremely important.
Now you say then replace hormones only when necessary. So you're not just giving everybody hormones.
No, but that was going to my next point, was that you also have to look at hormones because those also affect how you are, how you feel. And if your hormones are out of balance, then we have to replenish those hormones and bring them to a more youthful level. And that is part of the initial process of what we go through with each individual patient.
Now, we've had you on the program before talking about weight loss and hormones.
Yes.
Tell me about your typical patient. Who goes to you?
Well, you know, it's interesting because before we had patients who were more like the middle-aged, 45 and 55, but now I see actually a much greater variety of patients from 18 to 80.
Okay.
And the good news is that I'm able to help all those patients because even though you may be 18 or 20 years old, you still may have some hormonal imbalances. Of course, the 18, 20-year-old patient is not going to have the same hormonal problem as the 45 or 55-year-old woman who's starting to go through perimenopause and then becoming menopausal. But nevertheless, it is interesting to note that all of those people have some relationship to hormones, to nutrition, to supplementation.
Okay.
So now we can do all of that in one place. So I can see patients who are coming in for different reasons, but really when we do the evaluation and the assessment, we find out that they do have some hormonal imbalances and also some nutritional deficiencies.
Now, how did you get wrapped up in the weight loss field of medicine?
Well, when I first started out, Randy, I was a typical family physician doing internal medicine, and I found that most of my patients had the same basic problem. They all were diabetics, they were hypertensive, they had cardiac disease, they had high cholesterol. And the one thing that I noticed early on that they all had basically in common is that they were basically overweight. So it was like a light bulb went up in my head, and I realized that unless I controlled the weight, that these patients continue to have issues that could not be.
So weight loss and hormones, though?
Weight loss. Well, initially I started out with just nutrition because I had not really gotten the idea of hormones being involved. And then what I started to do is I started to get involved in this preventative integrative medicine where we utilize natural hormone replacement, supplementation, bariatric medicine. And through that, I realized that not only is there a nutritional and supplemental deficiency, but unless you treat the hormonal deficiencies, it really becomes an impossibility to treat that patient. So you can't do one without the other. It's very important to both look at their nutrition, but you also have to be able to balance out their hormones, whether they're estrogen, progesterone, testosterone. Insulin is another hormone that a lot of people do not understand, but unless you control insulin, that's one of the hormones that is really involved in appetite. So unless you control the insulin level, you're not going to be able to control that appetite.
So what do you do, somebody with cravings out of control?
Well,
I mean, what hormones can affect cravings?
There are a lot of hormones that can affect cravings. Cortisol, for instance. We have dopamine, we have insulin or insulin resistance. All of these things you have to look at and try to make a balance between those hormones and what the patient is doing. And a lot of times the cortisol level is affected because they are under a great deal of stress. Poor sleepers, people who are under a great deal of stress, affects their cortisol level, and unfortunately what cortisol does, it actually puts fat around the middle, and that's the last place most people want to put it.
So you can lower that. You can lower that.
Well, we try to lower it. And there's many different ways. We look at neurotransmitters. We look at, again, like I said, I look at different hormones. Each hormone affects every other hormone. For instance, if you have too little of one, then something else takes over. For instance, if your thyroid is non-functioning properly, women miss periods, and the first thing they think is they're either pregnant or something else is going on. And a lot of doctors don't necessarily look at their thyroid. But if you look at the thyroid and if you balance it out, then the hormones also start to balance out.
Is that a weight loss hormone as well?
Well, well, it is a metabolic hormone, so that's one of the key hormones to help with weight loss, because it is the energizing hormone. It's the metabolic hormone. So not too little will slow you down, and too much of it will make you too hyper. So you have to find the proper balance. It's like the idle on a car, you know, not too little, not too much. You have to have it just at the right level to make everything else function properly. Okay, now you have 10 keys. We're going to take a quick break. Okay. We're going to cover your 10 keys that you say will put anybody in hormonal balance and get them to lose weight. So we're going to take a quick break. Okay. You're watching The Wellness Hour. Up next, Dr. Weiss's 10 keys to bring back balance to your hormones, but more importantly, today's topic, how to burn body fat at your genetic maximum. We'll be right back.